Welcome. My name is Jeanette Wider, and I am editor-in-chief of Healthcare Purchasing News. Today, I'm here with Tracy Timmerman. She is Senior Marketing Manager for Midmark. Tracy, how are you today?
I'm great, Jeanette. Thank you.
Great. So I was thinking we could talk a little bit today about the five-step instrument processing workflow and the value of medical-grade cabinetry. So my first question for you is, why is following a five-step instrument processing process important to maintaining compliance?
That's a really good question, Jeanette, and there's a lot to it. So I think the first thing that might be helpful to do is first kind of unpack the landscape and some of the challenges in this instrument processing space, and then I'll kind of loop into the 5 steps. Does that sound okay?
Yeah, that sounds great.
Cool, great. So the people working in these spaces, they are tasked with just a multitude of tasks and balancing. So they're constantly striving to balance the patient experience while also ensuring that they're properly processing their instruments. And then on top of that, if they're in an accredited facility, and hopefully they're in an accredited facility, they have to be prepared for accreditation providers such as the Joint Commission or another accrediting organization to come in and conduct surveys. And what those surveys are doing is that they are working to ensure that that facility is really conforming to best practices and adhering to their standard operating procedures. And those items, they have to follow things such as a manufacturer's IFUs and standards, recommended practices, and evidence-based guidelines that are published by government agencies such as the CDC or a professional organization such as AMI, which is the Association for Advancement of Medical Instrumentation, excuse me. And then if they're not, that facility could be cited, and they would have to submit for corrective action, or worst case, they could be temporarily shut down while they address that corrective action. So there is a lot of pressure on the people in these spaces, and it's a really critical role, and it's just really taxing. So burnout is real in this space, absolutely. And as staff turn over, resources become constrained even more. And then, of course, you need to take the time and the energy to train and onboard new staff, which is timely and costly. So therefore, that kind of brings us back to the question of why are the 5 steps so important? So those 5 steps, they're really going to help you adhere to some of those guidelines from CDC and AMI. They're going to improve that workflow. They're going to work from a dirty to clean environment, and it's really going to simplify that process. So the 5 steps, that's just going to be, you're going to bring in those contaminated instruments into the space. They're going to be cleaned or decontaminated. They'll be prep and packed. They'll be sterilized. While they're being sterilized, they'll be monitored for sterility assurance, and then stored in a clean and dry environment. So again, just a very streamlined 5-step process to make sure that the space is working for the people within that space and that they're adhering to those guidelines.
Right. So that brings me to my next question, which is, what is the value of medical grade cabinetry in the clinical environment?
Yeah, no, that's a good question as well, Jeanette. And I think whenever you just start to consider what's in the instrument processing space, the value of that medical grade cabinetry starts to become pretty clear. So again, within that space, if you're bringing in these dirty instruments to be cleaned and decontaminated, they're inspected, dried and packed, loaded into the sterilizer and stored. And given the presence of things in that space, you have sinks, you're going to have ultrasonic cleaners, and then of course the sterilizer itself, which is going to emit some steam. So can be a very wet and highly humid environment. So therefore, having that cabinetry that's designed to withstand these conditions to prevent that moisture and damage is really important. That's really why Midmark designed our synthesis cabinetry to feature that steel on steel construction. So we have the steel side panels, and those with the steel brackets, and then we have the doors. The front panels are made out of a high density MDF, which is all then wrapped in a thermal foil, seamless foil to, again, it's a smooth surface, easier to clean, very durable to be able to stand the test of time. Whereas if you're putting in a consumer grade or millwork, that's going to break down faster, causing really that splitting, cracking, and swelling. And this is this, so it's just immediately you're going to have this challenge when you're bringing in kind of these dirty, contaminated instruments into a space. You really want to think about that cabinetry. It's so important. In fact, I think Amy, they have a section under their ST79 standards. I think it's 335, where they actually call out that surfaces that are durable, smooth, and cleanable allow for ease of cleaning to prevent that buildup of dirt and debris in those cracks and crevices. So again, just really highlighting the importance of that medical grade cabinetry where it's seamless and very straightforward to clean. So yes, often overlooked, but certainly something that you want to spend some time considering, because this is a very, could be a very high contaminated space.
Right, right. That totally makes sense. And sort of piggybacking off what you just explained to us about the design, how does cabinetry design impact workflow efficiency and safety initiatives for the healthcare experience for both patients and caregivers?
Sure. So I guess we'll look at workflow efficiency first. So regardless of the size or the shape of the instrument processing area, we recognize that some of our customers, they are starting with a blank slate and they're building a new facility and they can design it exactly how they want. Oftentimes we have our designers here at Midmark are working right alongside those architects, and we're talking about things like AAMI and CDC guidelines and FGI guidelines and the like. And you really can design the space the way you would like. In other cases, maybe you're retrofitting a space or demoing a current facility and you're a little more limited. Regardless of the situation, what the important piece is that it's a standardized workflow. And again, that workflow, it should move from a dirty to clean. So you're following those 5 steps that we probably previously talked about that are supported by CDC and AAMI. And this really is just going to help ensure that the space is reproducible, simple to follow, and that it's just really built to take some of that strain off of the people working in that space so that they can focus more time on their patients. And then in regards to safety, again, bringing in that cabinetry, we again really want to make sure that the cabinetry is designed to withstand that daily use and rigorous cleaning and disinfection that happens in that spaces. So again, if you're using that low-cost laminate cabinetry, the risk is that it starts to swell and crack and potentially harbor bacteria, and then your staff could be exposed, or instruments could become recontaminated, impacting patient safety as well. So again, it's just really important to have that cabinetry specifically designed for that medical environment that incorporates the seamless designs, easy to clean. Even antimicrobial handles and surfaces can help protect against infections in that space. So then whenever you put the two of those together, right? So you've got this efficient workflow of working from dirty to clean. You've built in for infection prevention. That does truly enhance the experience for both the patient and the caregiver. So the care team, they now will have a space that really works for them. Remember, they have a lot of tasks that they're trying to balance. We want a space that works for them so that they can focus on the patient. And then the patient, in turn, they're going to receive a better care experience, and they can just really feel assured that the necessary precautions have been taken to make sure that they are in a very safe experience.
Interesting. That's really, thank you for sharing that. I'm definitely going to be looking at the cabinetry next time I'm at a facility.
Oh yeah, you'll never look at it the same.
I definitely not after today. So does Midmark offer any educational opportunities on this subject?
Oh, I'm really glad that you asked. We do actually have clinical trainers on staff. They will come in. So this can be very, it's an overwhelming space. So we have clinical trainers who can come in and they can help train up your staff, make them feel super comfortable in this space. And then we've also recently launched some CEU credits. We partnered with Fiedler division within AORN, where you can go in. It's on demand credits covering the instrument processing space. And through that, you'll learn how they really focus on IFUs, following IFUs throughout the IP journey. and how that can reduce and prevent infections. And then they also talk about optimizing the workflow within that space. So definitely would recommend checking those out. Those are some newer offerings from Midmark, but yeah, definitely have a team here to support our customers.
Great. Well, unfortunately, that's all the time we have for today, but thank you so much for joining me, Tracy.
Yeah, thanks, Jeanette. I enjoyed the discussion. Thanks for having me.